Hey guys, this is Travis with Beyond Bipolar Vlog. I'm with my brother today, so we're driving up to an anime con today. It's been a while since we actually gone out and went to a convention. I'm pretty excited. I'm dressed as Dragon Ball Z. Kyle's dressed as a Pokemon trainer. I want to actually put a footnote to Sabrina Zhang or Susan Zhang because she actually made these costumes. I really appreciate it.
Thank you.
Anyways, today we are going to talk about Doxepin. Now, if you are not familiar with Doxepin, Doxepin is an old antidepressant. I couldn't figure out what kind of antidepressant it is. I don't think it's an SNRI. I don't think it's SSRI. But I do know for a fact it is used for major depression disorder and anxiety disorder. However, I actually clinically used to use it for sleep. Now, the dosage can range for sleep anywhere from 10 to 20 milligrams. 1 to 2 pills at night. They usually come in a yellow pill. I'll just tell you some experience when I used to be on it. So when I was on Lithium, I used to take the drug because, I guess beforehand I wasn't getting proper sleep. I would be up late and not be able to get some sleep. Now that is pretty similar right now, but I learned to get used to it and adjust to getting less sleep or not falling asleep right away. But back in the past when I was on Lithium, I thought it did really good for making me sleep throughout the night. And personally, back then I thought it did a good job. But when I reached out to my psychiatrist the last time, he said that I've been over-medicated and it's best to be on little as medication as possible for the most appropriate relief for your symptoms that you're experiencing. Now, for me, I don't think it really changed much or altered my mood in terms of something better, but I do know for certain it made me pretty groggy when I wake up in the morning. And later when I took it again and when I tried on Lamictal, it made me actually more suicidal and depressed. So once I tried it again, I decided to just totally get off it and not use it anymore. But it is generally used for sleep. And for people that are not familiar with the drug, I just want you guys to know that it does definitely work. It does definitely help sleep. If you are a person that struggles with an addictive personality and addicted to benzodiazepines, you're afraid to be on it, I feel like you can consistently be on this drug without getting too much addicted to the drug. You have Xanax, Klonopin, or lorazepam do not work for you. Ativan, another name for it, does not work for you. Or you try Visceral and that does not work for you. Another anti-anxiety, beta blocker, or another like melatonin over-the-counter meds. If those stuff don't work, I recommend Doxepin. Now, like I said, right now is that it can definitely increase suicide ideations, especially when you wake up in the morning. It will knock you out, but if you experience any type of suicidal thoughts, it's probably not the best drug for you. Like I said, it used to work with Lithium when I was on a high dose, but I'm no longer on that. I now take Lamictal, and I currently seem to be doing fine without the drug. My brother has actually never been on this drug, but I do know for certain that for me, if you have bipolar disorder and you're on a mood stabilizer or antipsychotic and you need something to help give you that extra sleep at night, like I used to get 12 hours. Now I get anywhere from 9 to 10, 8 to 10 maybe, 10 on the most common basis. But for me, I feel like it definitely helped me sleep early at night, especially from having anxiety or angst and not be able to fall asleep. And it definitely helped to keep me asleep at night. But if you're not looking to sleep long term, then I don't recommend this drug. I recommend it for people that are really hard sleepers. It's a definitely good basis when it comes to sleep. Now, I don't know the effects when it comes to people that just take it for a mood, depression, major depression, or anxiety. I don't know the facts when it comes to doing that long term. I do know for a fact that it can cause weight gain, but for me, it was kind of weight neutral. I don't remember having too many side effects on it. I was on it for a good year to year and a half. I do want you guys to know that it's probably a tertiary option. if you know benzos aren't for you, or you know visceral beta blockers aren't for you, then give this a try. It might actually help you sleep at night.
I don't even think benzos should even be recommended because they're so addictive, though.
Kyle believes that benzos should not be used, but I do know for certain many people like to use the drug because it's fast acting. And Kyle does have some reasonable reason why he feels benzos should not be used primarily as first resort, because they do have an addiction, or people can develop addiction to it, and you actually develop tolerance over a period of time. And if you try to wean off it, it can cause akathisia or long-term side effects and can affect the regularity of your heart. So be caution. Talk to your psychiatrist if you want to try benzos. I just personally feel there's less side effects when it comes to like weight gain or mood instability. I don't know for a fact that benzos cause suicidations. I do know, however, it does become less effective over time. However, with Doxepin, I felt it's also called Sinequan. I also feel that it worked long term. I didn't have any addictive qualities to it. I was able to wean off it pretty quickly. You're able to start it at a pretty low dose, maybe 10 to 20 milligrams. I'm not sure about target dose for anxiety and depression. I just know it's an older drug, so maybe that's why people do not use it as frequently as like newer drugs like the med that we just talked about, which Kyle was on.
What about Doxepin and borderline personality disorder that you're talking about, or you don't recommend it?
I don't know enough about borderline personality disorder. If you struggle with anxiety and depression, I have never known that Doxepin can be used as a PRN. I do know Seroquel, an antipsychotic, low dose, and a benzo, 0.5 to 1 milligrams of Ativan, can be used for anxiety and just calming the mood if you just get intense. There's a lot of people that experience rage with bipolar disorder, borderline personality disorder. I do not know for a fact if it can help you with those type of symptoms. It may actually slow you down a bit. However, any type of drug can have some side effect on you. However, with good therapy, DBT or cognitive behavioral therapy, that can also help you adjust to your life much better and manage your life for future reasons.
What's the target dose of Doxepin?
So I don't know the target dose of Doxepin.
How much
like
were you
I said.
taking?
I was taking 10 to 20 milligrams, 1 to 2 pills at night. I even think I maybe went up to 3 pills, but it definitely does make you groggy, and that's the whole reason why I don't take it anymore. It's just because it made me suicidal, and I don't think it was necessary. So if you guys are looking for a sleep aid, give this drug a shot. I think it does good wonders for you. However, if it makes you very suicidal, then try to get off it as soon as possible.
I think we should talk about Klonopin and maybe Ativan in the next video, or unless you already did that.
Well, I have one video that's actually gaining traction, so I don't think it's totally necessary, but I don't know, I think that's a short video. I just don't think there's much to talk about unless you have some questions.
Did you need to eat food with this?
This drug, it's not required to eat food. However, I used to eat food generally because I was taking Latuda and it's required to eat food with it. I don't know the effects on vomiting or appetite. I just know for a fact there is some side effects of weight gain since it is an older type of antidepressant.
And this was better than Trazodone?
This was way better than Trazodone. It for certain actually put me to sleep. Trazodone, after 1 or 2 days, I would be up pretty consistently. I felt it never worked for me. However, this drug definitely, if you have bipolar disorder and you're on a mood stabilizer and a psychotic at target dose and you reach it, adding this little drug or this little small dose can definitely help you sleep better at night. So I think that's it. I don't know if Kyle's any other questions, but I think this is going to be a short video on Doxepin. Like I said, if you have bipolar disorder, it's great for your drug. It's great for you if you have sleep issues. It's also great for you if you have a generalized anxiety disorder or maybe major depression. Some people do take it. I just know for a fact I don't need it anymore because it does increase suicidations while on Lamictal. It did work while was on Lithium. However, everyone is different. Everybody reacts different to various drugs. I just hope you guys can keep this in your mind if you struggle with sleep. I know there's a lot of people that recently reached out to me saying that they struggle with sleep. So give this drug a shot. It may actually help you sleep better at
So
night.
Doxepin is an antidepressant, and it didn't cause any side effects with your bipolar to make you manic?
No, this drug actually really made me very drowsy during the day. So I was already on Latuda, which made me drowsy anyway, and Lithium made me drowsy, and being on this drug made me further drowsy. So not sure what I was thinking. I just felt like I needed 12 hours of sleep at night. However, now I'm getting less and I'm able to be more active and feel like I need to be on less drugs. And it's probably better for you to be on less drugs as long as you find something that's effective for you.
Should we maybe bring up the fact that they actually have a gene test for all these drugs that we've been talking
We
about,
can
or should
make
that
a
be a
separate
separate video? Okay.
So anyways, that's it. I hope you have a good one. Please like, comment, subscribe if you're interested in more mental health videos and experience with schizoaffective disorder or bipolar type. So take care, have a good one. Bye.
We're gonna go to the Anime Con today and sell some art at the Metacon today. All right, see ya. Bye.
Bye.